Well, we did something special last week.
A special delivery can sometimes require special care. That's where Intermountain Healthcare's flagship hospital comes in Murray.
That's right. Inside the Maternal Fetal Medicine unit, life is safely introduced to the world, but only after specialists take the best of precautions for mom as well as baby. We have a post-Mother's Day story now that exemplifies the love a mom has, of course, for her little one. It's a moment every single mother will always remember.
I found out I was expecting, and I was a little over 2 months.
Kui was a young mom-to-be with growing hopes and aspirations for her little one, but there was also a growing concern.
I explained to him the history of heart problems in my family. The heart condition that I had was a tear in the aorta. So when I was pregnant, the tear kept getting bigger over the weeks.
To keep safe watch over mom and baby, Kui was immediately put under the care of Dr. Holmgren in the Maternal Fetal Medicine unit at Intermountain Medical Center.
The Maternal Fetal Medicine Department, it's a subspecialty of obstetrics and gynecology, where we take care of high-risk patients.
In this department, expecting women are followed for a number of reasons. It could be due to a medical condition mom has, or a medical issue that the growing fetus has, or even both. They are considered high pregnancy risks. Also, things like multiples and age of the mother could be a reason to be followed by specialists at maternal fetal medicine. And here in Utah, doctors are seeing more of a need for this kind of special care.
Used to be, people in Utah seem to have kids at younger ages, but we do have a fair number of women that we're seeing that are, in their late 30s, 40s, and sometimes early 50s. There are special considerations that go into taking care of those women.
And another resource Intermountain Medical Center has is their staff and equipment for mom and baby after delivery.
We have a great neonatal intensive care unit here that can take babies as young as 23 weeks gestation.
And for Kui, the resources of the NICU and maternal fetal medicine was necessary during her pregnancy.
With her explaining to me what the risks were for me, I chose to go ahead with the pregnancy, even though I knew that it could be my life or my baby's life. And so she went ahead and explained everything as far as with what is going to happen with my heart if it keeps dilating.
Together, Kui and the doctors monitored baby and laid out a birthing plan that would be best for her unborn and also for mom, as she had now more than a baby to deliver.
Their plan was to go ahead and deliver the baby at 37 weeks, and then for me to rest for 2 weeks and then have the open heart surgery.
But in medicine,
unfortunately, that didn't happen.
Not everything always goes according to plan.
On March 18th, I was rushed here to the hospital.
Kui had passed out and fainted at church. She and her husband knew it was time.
They said, we have to deliver your baby now because you're losing so much blood from your aortic aneurysm. So we're going to do the C-section, and we would recommend that you would tie your tubes.
In the moment, Kui agreed. She knew it was a matter of life and death for the future and the present. A mother and a baby's life were at stake, and the maternal fetal medicine unit was in charge now.
If it wasn't for the team here at IMC, I know my daughter and I wouldn't have made it.
Although early,
she was born at 28 weeks.
On March 18th, Kui delivered a tiny
3 pounds and 15 inches long
baby girl.
Her name is Heilala.
But as baby needed to grow strong after the early arrival, mom needed to get strong too and take care of her heart.
The surgery that they did, they went ahead and replaced the aorta with a pig valve. Ooh, big yawn.
And today, mom and baby are both doing extremely well, getting stronger, healthier, and ever so blessed.
When I look at her, it's just a miracle that we were both able to make it. I'm just so grateful that we have that little blessing in our life.
Isn't she precious? Heilala is now about 5 pounds, and Kui tells us that she is going to be able to go home any day now.
It's such a blessing.
Yeah. For more information on the Maternal Fetal Medicine Unit at Intermountain Healthcare, you can go to their website. It is intermountainhealthcare.org. And something to remember, moms, whether it's your first child or second, third, whatever, early detection is key. So if you know of health history problems, talk to your doctor immediately. Also, before you get pregnant, pre-pregnancy consultation is also recommended if you have some health issues.
It's amazing.
Yep. Love to see that new life. We'll be back in just a minute with more on Fresh